My name is Leila Yousefi. My supervisor is Dr. Alan Tucker. And my research topic is about predicting disease complications. And what I do in my research, and the novelty is discovering hidden variables, that is unmeasured data, clinical data, with using Bayesian network, and in the near future, Bayesian deep learning. So, as I said, my research is about disease prediction. But I am working at the moment at clinical data like diabetes type 2 data, and also glaucoma from Moorfield Eye Hospital, and also diabetes data from Pavia Hospital in Italy. Why I am choosing diabetes type 2? Diabetes type 2 is the most common type of diabetes, as is known as a non-insulin resistant diabetes, and accounts for 90% of all kind of diabetes, all instances. And it will be, it is expected that in next 15 years, about 550 million people will suffer from this disease. So it's quite important to look at this disease, as is 8th leading cause of death worldwide. In here, in the picture, you see the complication in diabetes type 2. So first, I have to explain that my clinical data is for patients that they are already diagnosed with diabetes type 2. And what I am predicting and classifying is complication, like eye disease, nerve disease, nephropathy, and foot damage, heart disease, and a stroke. So the methodology I am going to use, and I'm using currently, is Bayesian network. A Bayesian network is based on the Bayes theorem that is invented by Thomas Bayes in 1763, and is based on the probability. Bayesian network actually is a framework for decision making and inference. I need to explain here. There is one challenge in the clinical data that we have to take into account. What is this challenge? Physicians often fail to measure all kind of risk factors, all kind of the symptoms and complications for each patient. There are different factors that we call it unmeasured factor or hidden or latent variable that we don't know what is that. Maybe it's blood pressure, maybe it's cholesterol, maybe it's BMI or other risk factors that affect diabetes type 2 patients. So we need to discover this unmeasured or hidden variable. And this is one of my, this is the most important research question of my research. So methodology. As I said, I'm using Bayesian network. Why I use Bayesian network? I would like to reduce uncertainty. I would like to know the disease better. I would like to predict disease more accurate. Uncertainty is like unmeasured variable, like latent variable. So I will discover and reduce this uncertainty with using IC star algorithm. IC star algorithm is inductive causation that is for reducing the uncertainty within the data. From IC star algorithm, I will get one matrix of correlation between different risk factors. So, for example, you can see in here, as it's clear. So in my research, I tried to find the interaction between different risk factors like blood pressure, smoking habit, BMI, cholesterol, to find this interaction between this risk factor and hidden factors. Because as I said, there is some unmeasured hidden variable that cause unmeasured interaction. I have used several different methods till now. First, my data is really unbalanced, and there is lots of bias. I have to remove them. I have used the time series bootstrapping for reducing the amount of the bias in my data. And also I use the other method that I call it that's a pair balanced method, that I use just the pair that shows the patient have developed the disease. I will explain this in next slide in more detail. So the chart, the flow chart, you see in the right side shows my stepwise algorithm that try to discover hidden variable at each step of learning method. So I use dynamic Bayesian method first to discover my first hidden factors, and then I run it again and assume that the already found hidden factor is one of the risk factor, one of the observed risk factor. I assume it is in my data in the next step, and I learn the data again, and I find the next hidden factor. And I continue until I will get a good result in confusion matrix, good accuracy. So just a brief view of my data to make it more clear for you. So this is, I have different patients. This is patient ID. This is for 3 different patients data, and they are visits. This patient has 6 visits. The next one has 3 visits. The last one has just 2 visits. And each patient has different risk factor. And by using this stepwise algorithm, I learn in each step one hidden factor, one unmeasured variable. So just a little bit quick. So this is the result of the confusion matrix. So just ignore that if it's confusing, because confusion matrix is really confusing. Hidden variable discovery. I just want to explain that what I mean by discovering hidden variable and why I am using that, because I want to find the correlation, the dependency between different risk factors, the relationship, how the person that is smoking for 5 years will develop liver disease in next 2 years. So I am using first, this is 1 hidden, 2 hidden, and 3 hidden. And I have got a good result comparing different complications, as you see, the precision, sensitivity, and recall. And thank you for listening. And in the future work, I will try to use deep learning, Bayesian deep learning, to learn more hidden layers. And this is my publication and submission until now. Thank you. Any questions?